SOLO-1 is has been presented at the presidential session at ESMO 2018, and it shows the significance of this landmark trial. So SOLO-1 is a landmark study, which is the first phase 3 study of a maintenance PARP inhibitor in the frontline setting for women with advanced ovarian cancer. So SOLO-1, I believe, will have a fundamental change in the way we address treatment of women with newly diagnosed ovarian cancer. So this was a randomized, double-blinded, placebo-controlled phase 3 study with international collaborations where women with advanced disease were randomized to receive maintenance Olaparib or placebo following standard of care, so surgery and platinum-based chemotherapy. And those women that derived a response were then randomized in a 2-to-1 fashion. 391 women were enrolled into this study, and the primary endpoint was progression-free survival. So the study met its primary endpoint, and there was a significant, meaningful and clinically meaningful benefit for women with maintenance Olaparib in terms of improvement in progression-free survival with a hazard ratio of 0.3, so a 70% improvement in progression-free survival. The median progression-free survival in the placebo arm was around 13.8 months, and it hasn't actually been reached in the Olaparib treatment arm. But with Kaplan-Meier estimates, we estimate that the benefit is going to be in the region of 3 years. So this is outstanding for women with BRCA mutated ovarian cancer and a real important change. So what we see is that if we look at the 4-year point, that over 50% of women are progression-free in the Olaparib treated arm compared to 11% in the placebo arm. And what's so significant about this study is that we know that PARP inhibitors have activity in relapse disease, leading to the license of Olaparib, Niraparib and Rucaparib. But what we haven't known thus far is about the activity in the frontline setting and the magnitude of that. And the significance of frontline treatment is that that's where we've got the potential to improve overall survival and cure rates. Now we need to wait for the overall survival data, but to date the progression-free survival too is encouraging, with a significant improvement again to the second progression event, and so we need to watch this space. Thinking about toxicities, there were no new signals of side effects with Olaparib compared to what we've seen in the relapse setting. Most were mild to moderate. Grade 3 toxicities of significance were anemia with just over 20% and neutropenia just under 10%. But overall, very encouraging, and I really believe this is going to change practice. I think that we know that we have license for multiple PARP inhibitors in the relapse setting. I very much hope that the community of oncologists and patients and regulatory bodies see the benefit of how this could change the outlook for women with BRCA mutated ovarian cancer. So the next steps, which I'm sure will be done, is going to the regulatory authorities regarding this. And in order to institute this in standard practice, we really need to make sure that women are tested and the results coming back in a timely fashion, because it actually changes practice and the treatment for women if they have a BRCA mutation in the frontline setting.